Why, where, how to fix it? Back pain is often caused by muscle strain, disc degeneration, and medical conditions like scoliosis and osteoporosis. A warm or cold compress, acupuncture, and medicines are all options for treatment. Injury, activity, and certain medical disorders can all cause back discomfort. It can afflict persons of any age for a variety of causes. Because of factors such as previous profession and degenerative disc disease, the probability of having lower back discomfort increases as people age. The bony lumbar spine, discs between the vertebrae, ligaments encircling the spine and discs, the spinal cord and nerves, the lower back muscles, abdominal and pelvic internal organs, or the skin around the lumbar area can all be responsible for lower back pain. Aortic issues, chest tumors, or inflammation of the spine can all cause upper back pain. Causes. The human back is a complicated structure made up of muscles, ligaments, tendons, discs, and bones that all work together to support the body and allow mobility. The discs, which resemble cartilage-like pads, cushion the spine segments. Problems with any of these components may result in back discomfort. But in some cases of back discomfort, the etiology is unknown. Strain, physical issues, and improper posture, among other factors, can cause damage. Muscle or ligament strain. A spasm of a muscle. Tension in the muscles. Discs that have been damaged. Accidents, fractures, or falls. Strain. The following activities can cause strains or spasms. Raising something incorrectly. Lifting anything that is excessively heavy. Making a sudden, awkward movement. Structural issues. There are numerous structural problems that can cause back discomfort, including ruptured discs. Discs cushion each vertebra in the spine. If the disc ruptures, greater pressure is placed on a nerve, resulting in back discomfort. Bulging discs. A bulging disc, like a ruptured disc, can put extra strain on a nerve. Sciatica. A sharp and shooting pain spreads down the back of the leg and through the buttock. This can happen when a bulging or herniated disc presses on a nerve or when a muscle pushes on the sciatic nerve specifically. Arthritis. Osteoarthritis can affect the hips, lower back, and other joints throughout the body. In rare circumstances, the space around the spinal cord becomes smaller. This is referred to as spinal stenosis by medical professionals. Odd spine curvature. If the spine curves in a way that isn't expected, it can cause back pain. Scoliosis is an example of this, in which the spine curves to the side. Osteoporosis. Bones, especially the vertebrae in the spine, become weak and porous, which makes compression fractures more likely. Kidney disorders, such as kidney stones or infections, can cause back pain. Posture and movement. When using a computer, slouching while sitting could cause back and shoulder problems to get worse over time. Poor posture or specific routine activities can also result in back discomfort. Twisting. Sneeze or coughing. Overstretching. Bending awkwardly or for extended periods of time. Something being pushed, pulled, lifted, or carried. Long periods of standing or sitting. Bending the neck forward, as when driving or working on a computer. Driving for long periods of time without stopping, even when not crouched. Sleeping on an unsupportive mattress that does not keep the spine straight. Additional reasons. The following medical conditions can contribute to back pain. The cauda equina is a bundle of spinal nerve roots that emerge from the lower end of the spinal cord. This illness is marked by a dull pain in the lower back and upper buttocks, as well as numbness in the buttocks, genitalia, and thighs. Bowel and bladder function problems can arise at times. Spinal cancer. A tumor on the spine may press against a nerve, causing back pain. When there are tumors or metastasis to the bone, structural damage to the bone itself can be painful. Spinal infection. A fever and a sore, warm spot on the back could indicate a spinal infection. Other infections. Pelvic inflammatory illnesses, as well as kidney or bladder infections, can cause back pain. Sleep disorders. Those who have sleep difficulties are more likely to have back discomfort than others. Shingles. This is an infection that can disrupt the nerves and cause back discomfort. This is determined by which nerves have been impacted. There will be a rash after the back pain. The most common sign of back pain is a soreness in the back, which can extend all the way down to the buttocks and legs. Depending on the damaged nerves, some back problems might produce discomfort in other places of the body. Without treatment, the pain frequently subsides. However, if any of the following symptoms arise, a person should consult a doctor. Unaccounted for weight loss. Fever. Back inflammation or edema. Chronic back discomfort that is not relieved by lying down or resting. Ache in the legs. Pain that extends below the knee. A recent back injury, blow, or trauma. Incontinence of the bladder. Urinating difficulties. Fecal incontinence, or the inability to regulate one's bowel motions. Numbness in the genital area. Numbness in the anus. Tingling in the buttocks. When should you consult a specialist? If a person feels numb or tingly, or if they have back pain, they should seek medical attention. It does not get better with rest. Following an injury or a fall. With tingling in the legs. With a flaw. Afflicted by fever. Accompanied by unexplained weight loss. Treatment. Back pain usually goes away with rest and home remedies, but sometimes you need to see a doctor. Treatment at home. Over-the-counter, OTC, pain relievers, typically nonsteroidal anti-inflammatory medications, NSAIDs, like ibuprofen, can alleviate discomfort. A hot compress or an ice pack applied to the affected area may also help relieve pain. Taking a break from hard work can help, but moving around will help with stiffness, pain, and weak muscles. Medical attention. If home remedies do not help back pain, a doctor may prescribe one or both of the following medications or physical therapy. Medication. If you have back pain that doesn't go away with over-the-counter painkillers, you may need a prescription NSAID. Narcotics such as codeine or hydrocodone may be administered for brief periods of time. A doctor must keep an eye on them closely. Doctors may also recommend muscle relaxants in some circumstances. Antidepressants, such as amitriptyline, trusted source, may be prescribed, although research into their usefulness is ongoing and the available evidence is inconsistent. Rehabilitation treatment. Heat, cold, ultrasound, and electrical stimulation, as well as various muscular release treatments, may assist in relieving discomfort in the back muscles and soft tissues. Once the pain goes away, a physical therapist may suggest some exercises to stretch and strengthen the back and abdominal muscles. Strategies for improving posture may also be beneficial. It's best to use the strategies regularly, even after the pain has gone away, to keep back pain from coming back. Injections of cortisol. If nothing else works, they may be injected into the space around the spinal cord called the epidural space. Cortisol is an anti-inflammatory medication. It aids in the reduction of inflammation surrounding the nerve roots. Injections may also be used to numb locations suspected of producing pain. Botox. Botox lowers pain by numbing sprained muscles and spasm, according to research from a trusted source. These injections work for about 3 to 4 months. Traction. To extend the back, pulleys and weights are employed. This may result in a herniated disc returning to its original place. It can also help with pain relief, but only when traction is used. Cognitive behavioral treatment, CBT. By fostering new ways of thinking, cognitive behavioral therapy, CBT, can help manage chronic back pain. It could involve relaxation techniques as well as methods for maintaining a cheerful mindset. According to studies, people who receive CBT become more active in exercise, which lessens the chance of back pain recurrence. Watch us for more into back pain issues. www.newstoday.nyc or at News Reviews at YouTube. Thanks.